Hello, ladies and gentlemen. We are starting the session, giving health a chance. And we have a great line of panelists here. Our moderator for the session will be Amit Mookim, who is the MD South Asia of IQVIA. He's also the Vice President of TiEcon Mumbai. And the other panelists are Samyak Chakrabarty from X Billion Labs, Mahesh Jairaman from Sepalika.com, and that's it, right? Okay, just two of them. Okay. Amit, please carry on.
Yes. Good part about a cozy audience like this is we don't need to do any kind of speeches or panels. We can just sit and have a conversation, right? So thank you for being here. And I've got two of my very dear friends and fellow speakers who I'll introduce very shortly. But let me tell you, when we were thinking about this whole piece and why we thought it is so important to do this session, because everybody talks about healthcare, right? You know, when people say there's the next big opportunity is in healthcare, the next big opportunity is in AI, and today when Debjani was there, she was saying the big opportunity is in voice. So how can we convert voice into data and make decisions and have conversations which are technology enabled? But one of the things which we often forget is that, and let me do a show of hands here. How many this year, amongst the many goals you put, said that I want to be healthier and fitter? You see, we put this goal every year. We say we want to be fitter, we want to be healthier, we want to do this. But a lot of, when we reach the end of the year, then we think, you know, we shouldn't have had that one drink. We should have probably exercised a little more in the gym. We pinch our waist and we say, look, this should have been 2 inches lesser. And it's a lot about, ultimately, how we program and train our own minds, which we call behavior change and behavior management, right? And one of the theses, at least, we thought, and let me also introduce IQVIA to you. We are a human data science company. It's a Fortune 500 company headquartered in the US. And our premise is to work with real world and patient data. So as of today, we process about 45 billion health transactions every year, which is more than the number of Google searches that happen. And we have access to, and we work on 500 million patient records, which is a little less than 10% of the world population. And we run about 1,000 research trials every year on various diseases across the world with almost 25,000 hospitals. So we are like an information powerhouse. Our objective is to bring in human science and data science together and actually work through how this could make an impact on healthcare. And one of the pieces which we think is missing in the whole link is really understanding how humans think and behave. And that's a big, big piece in my view around disease management, reversing chronic diseases, making our own lives healthier and more energy. I've got two of my friends and really experts from the industry because they're trying to do something very different. Dr. Mahesh Jairaman, who I've known for the last 3 years, and I remember the first time I met, he was on his way back from the US, trying to create a business in healthcare in India. And I still remember his vision. He said, Amit, I don't want to treat people, I want to reverse diseases. And I want to do it in a way where actually I work very closely with a patient and an individual across all dimensions of his health. And Mahesh has, from there on, actually worked through creating a very interesting model for healthcare prevention and reversal, which I'll ask him to share and talk about. And the other gentleman next to him is Samyak. Samyak is part of the UN Young Changemakers Conclave. And Samyak's personal goal, which really I look towards, he said, look, I want to make a change to 1 billion lives. And that's why he called his company X Billion Labs, which is really a company that is trying to drive change through skill building, behavior change via the use of technology. So gentlemen, please welcome to the panel. And I would request both of you to share your perspectives on what you think is really your business all about and how you see this evolving. And what we'll do is, we've got about an hour, right? So I had requested the gentlemen to speak for about 15 minutes each. Mahesh would start, followed by Samyak. And then, given the size of this audience, I would really want us to have as much a dialogue as possible. I'm sure there are people who are interested in healthcare, technology, and entrepreneurship here. And it'll be great to understand what you do, and is there any way in which we can further build on your own thought process? Yeah. Okay.
Correction to begin with. I'm just Mahesh Jairaman. Amit fondly likes to call me a doctor. And the reason for that is that I'm one of those wounded warriors, as they call them. Corporate healthcare in India nearly killed my wife about 2 decades ago. That's how I got into all of this. And I began looking at the core of health. How do we know we are healthy? What is it that actually constitutes health? How can we ensure that we're doing the right things in order to stay healthy? Is disease really what it seems like? And is it right to treat diseases with pills of any kind? So it isn't that I have a personal sort of grouse only against allopathy or chemical pills. I need to understand why any kind of pills are needed to reverse any kind of disease. So that's my that's the background. That's how I got started. So when Amit asked me if I'd be part of this session with Samyak, I was really excited because I know that Samyak comes from a background of behavior change. And in my short introduction of what it is that we do, I will try to explain to you why I believe that the future of all medicine is going to be about behavior change. Nothing else but behavior change. That is my sort of bold premise that I present to this audience, and I'd be happy to be challenged on that. So I was going through some of the stuff before we got started, and a 2017 CSE study published in November, Center for Science and Environment, found that 61% of deaths in India now happen due to non-communicable lifestyle diseases. Right? So we've gone past the age of infectious diseases. We no longer have bacteria alone that are killing us, especially because we've killed so many of them. I don't think there are too many of them left, good or bad. We're getting only severely resistant versions of bacteria from hospitals and similar such, what's called iatrogenic diseases, diseases caused unwittingly by hospitals and doctors. I also came across a study from rural India, which was even more telling. So lifestyle diseases having overtaken infectious diseases as the #1 killer of human populations, not just everywhere in the world, but at home in India, where there was a study done on 24,000 adults. So we were just looking at obesity data from 2008. So this was a study that was done on 24,000 adults, out of which 11,000 were men, 13,000 were women in a rural Indian setting. Obesity or being overweight was 10.1 in men in 2008, 14.6 in women. That's percentage numbers, so 10% and 14.6. And in 2017, the same number had gone up to 17.3 in men. That's like nearly a doubling. And 24.7 in women. Again, almost double from 14 up, so 80% increase. This is just being overweight. And being overweight has been linked to so many chronic diseases, type 2 diabetes, polycystic ovary disease, hypothyroid. The list is really, really long. And that's the reason why I feel that it's really behavior change. What we do every day is who we become. There is an old Ayurvedic saying that abhyas makes sanskar. For, just to translate loosely, it's habits that will finally make who you are, whether you call it character, personality, or health. What you do every day is basically what you become. So I believe it's the easy availability of processed foods, especially things like refined flour, maida, the products that we get. Try and take a trip into rural India anywhere without finding a shop that has these plastic packets full of chips, Kurkure, I'm sorry to name a brand, but there you have it. So you've got soft drinks, you've got really cheaply packaged processed foods, all of which leads to a quick satisfaction, a hit that all of us want. It leads to secretion of dopamine, and eventually it tells on your health. So my number one premise for stating what I did is that lifestyle diseases have overtaken infectious diseases as the number one killer of human beings, and therefore we need to look at those sorts of diseases more seriously. Premise number two, lifestyle diseases can't be fixed by drugs. I don't think there's even a single doctor, allopathic or any other kind, who can claim that they actually are able to fix a lifestyle disease like, say, type 2 diabetes or hypothyroidism by just drugs. That's why you manage it for life. It's called disease management. It isn't called disease reversal, because the pill cannot reverse the disease. All it can do is mask the symptoms, and that's all we have currently on offer. Premise number three, tech offers a possibility to reach and change people's lifestyles by the millions. Penetration of smartphones in India is increasing every single year. And now that you have a smartphone in every hand, the likelihood of being able to change habits that are practiced via a mobile device, a smartphone, a tablet, is pretty phenomenal, the way in which you can reach it. So I come from a background before this whole wounded warrior business of being in the documentation and documentary space. I've created several documentaries for BBC World, and that's my background. I come from a media background. And I've worked extensively with UNICEF, the United Nations International Children's Fund, for helping them when they partner with the government of India to sort of roll out programs in rural areas on health, education, and so on. I'd like to mention, very briefly, a particular program that was run very successfully in Bihar and Uttar Pradesh, more in Bihar actually. It was called Gaant Bandh Lo, which literally translates to tie a knot. And this was a program that was about helping people remember the 5 things that a man of the house or a lady of the house needed to remember when the lady of the house was pregnant. So when she was ready for delivery, what were the 5 things the family had to have ready? This was part of the program, Government of India program, to try and reduce infant mortality. So to ensure that there was institutional delivery at a hospital, what are the 5 things you needed to remember? They were pretty simple. So the first one, which most people in the villages didn't often remember, was to have a little bit of money ready so that they could arrange for transport or emergency care or so on. Second was to identify a neighbor who was next door who would help take the lady to hospital. The third was to identify the nearest hospital. The fourth was to organize a mode of transport and so on. But what was unique about this program was that everywhere in Bihar, those of us familiar with rural India may know, there is a loose towel, a thin towel that they carry with them at all points of time. It's called a gamcha. So, you wipe your body with it because we are in tropical climate and it's really sweaty. So the participants in the program during this education were asked to tie a knot for each one of those habits. So Gaant Bandh Lo meant that each time you remembered a particular thing that you had to get ready for the delivery, you tied a knot. Simple way of just remembering. So people had 5 knots in their towel, and that made such a big difference to recall of these 5 habits, and it turned to be such a successful program that we actually saw within a period of 3 years such a lovely dip in the infant mortality. Behavior change had suddenly happened where all of the films and propaganda had failed, just somehow by asking people to tie knots in a towel. And I believe that the reason this happened is, if you look at the biology of behavior change, we are told that when you involve the motor cortex of the brain, that's when a behavior actually gets ingrained in a human being. You have to practice something physically at the point when you learn something else, and that can deepen the learning and turn it into habit. This is where activity-based learning comes from when we talk about education in children. So you've got a child who's looking at an alphabet A and also touching the cutout or a stencil cutout of an alphabet A. And when the child gets the tactile input at the same time as the child is learning the letter, the child never forgets the A. And that's the one little example of how you can have an influence on behavior change that has severe positive health outcomes. Imagine what you can do with a smartphone that actually gives some sort of a tactile response or asks for people to actually input something into the device that reminds them physically about whether they should be eating that extra puri or paratha or not. There is a way in which you can bring this technology back in. Number 4, understanding how human beings actually work. Understanding how behavior change happens. Why do people do the things that they do? And how can you actually influence them to change for the better? This is the part that needs to come in from the offline world. Once you take that understanding and you tie it back into technology is when you will be able to reach millions of people and actually influence the true sort of lifestyle diseases that we have today. So that's basically the premise on which we've built Sepalika. Sepalika runs India's first online polycystic ovary disease reversal program. For those who may not be familiar with PCOD, PCOD is a lifestyle disease. It affects literally 1 in 5 women in the reproductive age bracket. Imagine that's a huge number, both worldwide and in India. Often caused by eating the wrong foods, not getting sufficient exercise, leading a sedentary lifestyle that is very stressful and so on. And it is completely reversible. Conventional treatment for it with an allopath is that you get put on birth control pills, literally from the time you're 14 or 15. And then you produce false periods all the while the lady thinks that her PCOD is being fixed. PCOD doesn't get fixed in allopathy. It is a lifestyle disease and can be fixed only by lifestyle. So we've got a panel of allopathic doctors, Ayurvedic doctors, masters in nutrition, who all work together as a team, and you can participate from anywhere in India on the online program. We've treated about 200 patients now with an 82% success rate in producing natural periods, restoring natural periods to ladies with this problem. So one of the big issues they face is periods go awry. They put on too much of weight. It leads to infertility eventually, lots of hair loss, acne, all of those things. And we've had an 82% success rate in helping women restore the natural balance in their bodies by just changing their lifestyle, just eating the right foods at the right time, getting a little bit of exercise, getting the right dietary supplements, and you can move the health needle that severely. Just yesterday, we got a message. One of the most heartening sort of bits of news I receive every morning is some lady telling us, "Thank you so much, I've got my natural period. Yesterday's lady had got it after 20 years." And that's the power of changing behavior. Lifestyle diseases are the #1 killer of Indians and of people worldwide. It cannot be fixed with drugs of any kind. Not allopathic, not Ayurvedic, not homeopathic. Those are all small ways in which you can support the body as you change your lifestyle. And therefore, behavior change and lifestyle, I believe, is basically where we need to get in order to make a difference to health outcomes. So this is, I've spoken about the curative aspect, but I'm sure Samyak is going to get into the preventive parts of it. Imagine the power of something like this. What you do every day, if you can be rewarded for a right action, and if you can be given support from peers, using tech, using communities, using little reminders, the sorts of influence that you can have on an entire population, on an entire nation, in preventing something like type 2 diabetes from occurring. It's just phenomenal. So the opportunities are endless, and thank you very much for your attention and giving me the opportunity to explain what we do. Over to you, Amit. Thank you.
Thank you, Mahesh. Thank you for this. And you would now realize the reason why we didn't choose the traditional health startups that are out there, everybody trying to do this, because to me, this is really the future. And just to give you an example, when we look at a health startup, people usually talk about an app. There are close to 500,000 apps today. Okay, and that number was about 100,000 4 to 5 years ago. And only about 1.5% of those apps have in the success rate of downloads of more than a few hundred thousands or more. 98% of those apps have actually died a death between 3 to 6 months. So, and a primary part of that is many of them have focused just on a sliver of how to manage a particular symptom or condition and not really got into the depth of understanding how you drive and understand somebody's behavior and work towards a program. And that to us. And Mahesh, what you're doing is really what I think the future of healthcare is going to be.
Thank you. Thank you.
Samyak, over to you.
Thank you. That's my phone. Oh, it's yours. Thank you, Amit, for having me here and having me speak. Thank you, Mahesh, for setting the context for what I'm about to speak. While Mahesh addressed the curative aspect, I will go to maybe 2 levels deeper on the preventive aspect. But before we begin, can anybody tell me, I was wondering this morning, why do we have 1.3 billion people in our country? Does anybody know why we have 1.3 billion people? Anyone? Wow. Obviously, because we can't control ourselves. So that is human behavior. Human behavior is the cause as well as solution to, I think, perhaps every problem that humanity is facing today. In fact, human life itself is a cycle where we are the cause and the effect of everything that we do, and therefore what we receive. Human behavior is very irrational. We often think that, some of you might think you're a very logical person. Some of you, attending TiEcon, you would think that you're more intelligent than the person who's outside, but that's not true. Just like a computer, our human mind makes decisions based on bio algorithms. They are essentially formulas that are accumulated by data points of experiences of our lifetime, the influences of our peers, and according to some belief systems, through generations of experiences that our ancestors have had, they're all encoded and passed on through a genetic stream. But what is definitely concluded is that our behavior is not random, our behavior is not rational. It is a cumulative consequence of a computation of certain, as I said, bioalgorithms that drive action. Today, in today's digital world, when infotech is merging with biotech, you are able to use computer algorithms to influence bioalgorithms. As freaky as it sounds, as dangerous as it is, because such are the things that get people like Trump to power, because obviously behavioral science has been extensively used. But this same technology, but this same approach, that is the merging of your bioalgorithm, that is human decision making, with data and information, can be used positively to transform behavior. It can be used to incept positive thought and action for the good, as much as you can do for the bad. But before I get into that, I would like to briefly address 4 key factors that drive human behavior, in my opinion. And we will look at it from a lens of healthcare, obviously. 1, positive fear. One often thinks that you should incentivize in terms of, okay, what good will happen to you if you consume something or if you don't consume something. But that doesn't work. It is positive fear. What we have found is that when you tell people about the consequence of not doing and layer it with positive messaging, that is more impactful. For example, green tea, right? Firstly, the green tea that we drink on an everyday basis is a farce. It's tea dust. It doesn't do anything to us. It doesn't really prevent anything for us, but yet we drink green tea. Why? Because the positive fear is if you don't drink green tea, you might be fat. If you don't drink green tea, you might fall sick. If you don't drink green tea, your cigarette smoking will not be neutralized. And we immediately jump and we spend 200, 300, 400 rupees at the best of places in Bombay to drink green tea. So it is positive fear that is one of the most powerful drivers of urgent behavior change. See, often, when we are told to exercise, when we are told that go to the gym every morning, we don't move. But if a doctor says that you have 3 months or you're going to have a heart attack, it works. And I'm talking very simple. Unfortunately, we live in a time of great jargon, but actually behavioral science is quite simple and it is very intuitive. And therefore, I'm going to take very basic examples today. So green tea and positive fear, because it's something that we do in our everyday lives. Second is storytelling. I'm reading this book called Adar. It's on your Vedas. And I found that actually, the Vedas, the sages who wrote the Vedas knew a lot more about behavioral science than the current times of Cambridge Analytica and all these fancy behavioral scientists that we have. Because what they realize is that to get any human to take an action that is good, even if it may be good for him or her, you have to spin a story. So the first element, of course, is positive fear, but the second is story. Now, how many of you here fast every Tuesday? How many women fast every Tuesday for a good husband or for the long life of your husband?
Monday.
Monday, okay, I don't know. But some, okay, so we're obviously far, far away from the Vedic belief system, but I'm sure you know that many women across the country fast for a good husband for a long life. That's not true. It's basically to get your insulin. It should get your insulin in control. It's basically to detox your body. But how are you going to explain to a not so initiated audience about detox and about insulin? So in the olden times, you have a story that says that fast for your husband or fast for your child or fast for God. And here is also this positive fear that if you don't fast, you will not get a good husband. Ganpati will get angry at you and so on and so forth. So storytelling, it works, right? In a more modern avatar, 10,000 steps. And I club it to what Mahesh said, that you have to have a physical action, because 10,000 steps is nothing but walking 2 kilometers a day, and that is something that we've read ever since. But the moment you make the story exciting that you're walking 10,000 steps, make it competitive, because now you can link it to an app and then everybody's competing, and I think it's a great thing, but still it's a story, right? The third, now I began by saying that incentive doesn't work, which means that we will never practice a preventive healthcare recommendation if people say it's good for us. But here the third point is incentive is what you will get. Now, a lot of people operate on transactionality. A lot of our behavior is transactional. As contradictory as it sounds, that even though if it is good for us, that's not a powerful enough transaction. Because while Amit and I may talk about preventive healthcare this morning, Saturday evening we were enjoying a couple of beers together, right? So even though we know that that's not good for us, but we do it because we enjoy it, right? So we obviously need a more strategic incentive, which is external and not internal. So for example, I'm not sure where I stand on the ethical aspect of what I'm about to say, but the practical aspect is, so if you perform better on your health parameters, your insurance premium can reduce. That is a very solid incentive to offer to your working class, who is obviously getting tired and is pressurized to pay expensive insurance incentives. Or if in an ideal and a utopian world, which is not too far away, the government incentivizes you for taking care of your health. Because actually, if you see, it is more profitable for the government to give you incentive than to pay for the healthcare, and not just the healthcare costs. But for example, when you look at NCDs like PCOD or diabetes, it is also loss of productivity for the economy. So the third point is strategic incentive. I think that if you're able to combine positive fear with storytelling and thirdly strategic incentive, I think it can be a very powerful way to get people to truly prevent non-communicable diseases. The fourth and the more new age aspect, which is outside of the Vedas and outside of the knowledge of the Vedas, is the integration of technology, which is where I come from the first part of what I said about how your bioalgorithm is now going to be able to be hacked by computer algorithms. Now, as I said, while the same technology can be used to get you to buy products or vote for someone or perform an activity, you can also use the same paths to the human mind to incept positive messages, to incept messages to drive action. So, for example, the positive fear, the story, as well as the strategic incentive can be delivered and incepted through digital platforms. Because think about it, you are here because you read about TiEcon on Facebook, most of you. That means that something as simple as Facebook is driving you to leave your work on a Tuesday and come and sit here. Or it is driving you to perform so many actions that may not be natural of you. So now just imagine the power of leveraging data, big data, to target messaging. So for example, I'm not a very, much to my friend's disappointment, I'm not very concerned about my health. And he tries his best every time we meet he tries to incept positive behavior, but he's not been able to tell me a story, not create positive fear, not give me a strategic incentive yet. But I'm sure there is something that can be told to me because of which I will drive my decision. Today, big data allows you to do that because your social footprint can be used to be able to understand you better and see what your driver will be. For example, not for me, but I know what works very simple. What works on many guys is be healthy, you'll get a good-looking girlfriend, as shallow as it sounds. but it has actually put many men to work at gym, whether you like it or not. So big data allows you to target stories based on the psychology of the person, which Google or Facebook knows better than you or your parent or your spouse yourself, right? So the integration of technology and storytelling with these prior three powerful tools for behavior change that I spoke about can truly help you change behaviors at scale in a country like India. Because one of my other bones to pick with conventional behavioral change approaches, they have feet on street. But today you can't have feet on street. Today you're a country of 1.3 billion people, and if more than 50% are at risk of NCDs, then you have to reach 500 million people. Now obviously you can't do that with a feet on street model. So here what I'm trying to do at X Billion Action Lab is to integrate digital storytelling, targeting through big data on social platforms to be able to move the needle for people the way they will best be moved. I will give you a very different example, not linked to healthcare, but give you a more of an illustration. We run another movement under Action Lab called Adopt India, where we're trying to get urban adopt children instead or in addition to produce their own kids. Because India has 7 crore abandoned children. About 6% of our population is abandoned. And yet we are not adopting. So first I tried the usual, okay, there are so many hungry naked kids, they need a home, blah, 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 adopt. Didn't work, obviously. But what is working at an offline pilot right now is that, did you know, how many of you knew that Mahabharata exists because of adoption? Lord Krishna was adopted, fostered, but adopted. So what we're doing is we're using big data to target people who pray to ISKCON, who pray to Lord Krishna, and talk about how Krishna was adopted. Then there are environmentalists. Then we are talking about that there are X amount of tons of liters of water left in our country, and we have done a calculation of how much water one kid needs, and then we are creating infographics on how when every new mouth comes, how much water is going down. And that's working with the environmentalists. Then third target group is anti-establishment. People who want to just go against the system. So we are saying break the norms, adopt kids. So this is another example of how all the three elements of behavior change that I mentioned can also be used by integrating technology and storytelling to be able to transform behaviors at scale. But the most important thing is, and I would like to end by saying that in behavior change, what I have learned is A, you have to look within to understand yourself truly rather than many theories, and B, it has to happen sans judgment. If I judged people who don't want to adopt because they say the child will look dark, because that is one of the reasons why people don't adopt. If I judge obese people not wanting to change their behavior even though they are obese, I will never be able to get through their mind to truly understand why you're not adopting, why you are obese, even though you know obesity is bad for you. So it's very important to perform behavior change sans judgment. And I look forward to having a further dialogue on this subject. Thank you so much.
Thank you, Samyak. Okay, so this was, I'm sure you would agree, a very different spin on how we've looked at healthcare usually is delivered and managed. Now, a bit of realism while both of them spoke about it, right, and where we stand with respect to India. And let me share a few snippets with you because many of you all are sitting to figure out what the next business opportunity is and how do you get it off the ground, right? So there are 2 or 3 changes that are happening which are very relevant. One big piece that is happening is, of course, while our population is increasing at 1.5%, the number of chronic disease, the number of diagnoses related to chronic disease is also increasing. So more and more people are becoming aware that there are these individuals that are becoming prone to these diseases. Now that's where the healthcare industry is now looking at it as an opportunity to see how they push through more services and drugs and pharmaceuticals, right? That's the real part of the picture as it's happening. Now, as a result of that, on the public side, you would be aware that we've launched one of the largest universal health programs, right, which is Ayushman Bharat. It was launched in 28th September last year. We are close to 3 months of where we are. And I'll share a few statistics with you so that you understand where we are heading with it. Now, this particular program provides for 5 lakh rupees of cover to a family. It's nationally portable. As of yesterday, about 11 lakh families have got enrolled under this Ayushman Bharat, and 17,000 hospitals have got empaneled, and close to 985 crores of claims have been processed as part of this engine. Okay? Now, what is the government trying to do? The government is trying to roll out this scheme to cover 100 million families, which means 50 crore individuals and almost 60% of them, so 30 crore individuals who never had any healthcare, are now suddenly becoming aware, and they are thinking now that healthcare is my right. Okay? That's going to drive through a huge change if this engine continues, that an individual on the street will now demand healthcare out of the system. And our system today is not geared to deliver that healthcare. Okay? And to me, that's a massive, massive opportunity. It's a massive opportunity for entrepreneurs to think through how A, technology, B, tweaking the existing delivery models, and C, looking at behavior change and what Mahesh is trying to do could address the need of the system. So that's number one. Okay? Number two, what is happening today is you would be aware that we had GST, which happened 1.5 years ago. Now let me tell you what happened as a result of that, and I'll correlate 2 more data points along with it. While GST was happening, the world's largest startup, not healthcare startup, the world's largest startup got created in India, which was Jio, right? And what did Jio do? Jio catapulted us on data usage on the phone from below 100th rank to number 1 globally, right? So that's the second thing that happened while GST was being rolled out. The third thing that happened while all of this was going on is that 98.5% of our adult population got an Aadhaar card. And while all this is going on, the government has been rolling out an initiative which they are calling a National Health Resource Registry, where every village, town, and district in the country is being mapped on a UID for every health facility. So ultimately, what is happening today is the adult population, which now has a social security number, the adult population, all of whom who have data services on the phone, the supply chain, which has now become much more cleaner, if I may use the word, because of GST. And I'll tell you what happened as a result of GST as well. The entire supply chain in healthcare today has 800,000 chemists. It has 30,000 wholesalers and sub-stockists and 25,000 distributors, which push through 1.5 lakh crores of drugs through the pipeline. Okay? And as a result of GST, an entire wave of consolidation has started in this ecosystem. And that has huge ramifications on how drugs will be delivered and bought by people, because now a person has access to a phone, so his ability to purchase something has become much easier. The technology, and which has resulted in because of GST, because now suddenly most of these stockists and distributors need the right technology to service it, because earlier they would still work through a cash-based economy. Now it's no longer viable. Okay? So that's the second piece that is happening. And the third is, because of what is the largest universal health program in the world, there are 2 things that are taking place. You've got thousands of hospitals which never even thought about upgrading themselves. And there's something called NABH, which is quality accreditation. So almost 1,000 hospitals in tier 2 and tier 3 areas have started to apply for this accreditation, because they see that a massive amount of business is going to come down their way, right? So 4,500 hospitals over the last 2 months and the private side have empaneled themselves to participate in Ayushman Bharat, which means a massive healthcare market at a very different level is getting created beyond the urban metros and whatever we see around us. Okay? So that's, and to us it's a big change. Whether this government stays, doesn't stay, whatever happens, this juggernaut has started to move. Okay? And I see a hockey stick effect whenever it happens, when people will start believing and thinking that healthcare is their right. Till now, I don't think the Indian populace believe that healthcare is their right. But slowly but steadily, you would see that this thought is being seeded into the minds of individuals. And while this could be a big challenge in servicing, it leads to a big opportunity on this side. Now, second thing, what is happening? The whole Ayushman Bharat has been structured in a way that the government has created their own state trusts, okay, to service the population that is coming through the fold. And just to give you an example, like in Andhra, the population is close to 90 million. 48 million were under Arogyashri, another 20 million get added. So 70 to 80 million in large states are getting under the fold of Ayushman Bharat. As a result of this, and these are being administered through trusts. Now, what does it mean? That the processing of such claims. And there are millions and millions and billions of claims that get processed. And there is not enough machinery today to technologically process those claims. And one of the biggest pieces as a result of this, which the government is worried about, is the impact it will have on fraud, waste, and abuse. The system can be significantly misused. And we've seen it in China, that when universal healthcare was rolled out and 92% of China's population came under this fold, the two treatments that jumped significantly, almost 20 times, was hysterectomy and hernia, because more and more hospitals started to recruit patients and put them under these procedures so that they could claim. But having said that, there is a massive opportunity for technology on the fraud, waste, and abuse side to actually go back and participate in the system, number one. Number two, what is happening as a result of this is that the private insurers, because many of them did not have a big play on the Ayushman Bharat side, have now turned to see what they can do with corporates and what they can do with private hospitals, and what they can do with models such as Mahesh's or Samyak's to drive behavior change. So I don't know how many of you have heard of companies like Discovery and Momentum, which actually incentivize people based on good behavior. Those models have started to come to India. And now they are trying to create massive pools of population and work through either devices, gadgets, phones, and everything else, and charge very little, but the momentum or the volume of which, because of your charging very little, is creating such marketplaces. So the other big opportunity is, can you create such wellness marketplaces? And plug in people, because there are many, many companies that are trying to do this, but there are very few aggregators or marketplaces that are offering this as a solution to particular corporates. I mean, the corporate I work with has almost 15,000 people, and I've been looking for a wellness solution for the past 6 months. I haven't found any, so we've gone and created our own. But that's the big opportunity in the market. The third big piece, as a result of all this that is happening, is preventive care and primary health care. Okay? Now, the government has 350,000 establishments which they are now going to brand as wellness centers, and they're going to put in nutrition, diet counseling, diagnostics, point of care, testing, everything else. Okay? But if you see, the pieces of it are still missing. And one of the big areas where we see disruption that is going to happen is going to be in diagnostics. Okay? Cheap, low-cost diagnostics that will be available at the clinic to be administered and managed. Okay? And if you see the history of what's happening on diagnostics, it will move from taking your blood out to doing something else which may not require intravenous. So do look for these technologies that are out there, because they will be disruptive into what will happen. And these are some of the things which I would, if you all are looking at building out or entering into these spaces, are worth thinking about. Okay? Because for the first time in India, the opportunity exists on the private side, the opportunity exists on the institutional side, and the opportunity exists on the government side. We've never had this run in healthcare, and I think the next 8 to 10 years, we see, if as it comes along, with people wanting to spend and wanting to be healthier, I think there are many, many pieces that are still left to be covered or addressed. So I'll close here with whatever spiel I wanted to give, but we've got some time, and these two gentlemen, and what we would like to do is really, if there are any healthcare entrepreneurs in the audience, we would welcome them to talk about what they're doing so that we also can learn. And any other questions or anything you want to discuss would be very welcome.
So I'm at the cusp of your troubled past and your future, I guess. I am a psychiatrist, and I'm working on behavioral change for the last 3 years now. So we're on a small mental health platform, looking at solving one cusp of the behavioral change mental health specifically. And so, I think we just crossed the threshold. We crossed the 3 lakh download mark. Nothing. We're just about reaching sustainability, and we've treated about 4,000 people with human touch in the last sort of few months. And my question was, how? And we've done so. Some of the drivers you're talking about. So we just partnered with Geo as their mental health partner for the Geo Health Hub. Health Hub before launch has 2 million users. They've not even formally launched Geo Health Hub yet. They have 2 million users, right? And we've just partnered with IQVIA Health Insurance on the insurance side to look at how they can drive incentives in behavioral change as an insurance positive strategic incentive, essentially. The question really for me is, in the Indian market, in the entire conversation about prevention as well as behavioral change, how far away are we from doing that for mental health specifically? Largely because there's 150 million people with mental health difficulties that require treatment in India. We're not talking about subclinical problems, but I see very little happening both on the government side as well as private insurance side right now. The policies changed, the laws passed last year. But I think for me, that's been the big challenge in journey. Half our traffic comes from outside India. We don't even market it outside India. We do all our customer acquisition in India. Half our traffic comes from the US. So it's very interesting for me to see when does India reach a tipping point within the whole policy change and the private-public partnership change in the mental health space, actually.
Because I'm doing some extensive work on this space. As I said, Action Lab builds social movements to get people to change behavior. There's a couple of problems with mental health. Problems as in strategic problems from the point of view of what you're saying. One, mental health is a very abstract, is large. When I say very, it's comparatively abstract to diabetes. So your diagnostics are not very data-driven, but more observation-driven. So like hemoglobin, there is no indicator for depression, right? And to the novice mind who doesn't understand that, it'll be a bit difficult for them to digest the abstract indicators of depression or anxiety and so on. So at a policy level, so we've been talking extensively with the government on building incentives, because the larger problem is about more than 50% of your urban workforce is going to be at vulnerability of depression and anxiety, often caused by competition and lack of opportunity and so on. So, and the more number of people are depressed, the impact on productivity and therefore impact on national income. So there is a direct link in the consequence of mental health, but there is no indicator of causality, which is a precise indicator. So that's a problem from a policy standpoint. Second, from a behavior and a preventive standpoint, the patient's acceptance of that, the fact that he or she may have such a problem in the Indian context is a huge challenge because of restrictive belief systems. So I went through depression for 2 years. I went through a very, very bad bout of depression. I happily talk about it. But what helped me was the fact that my parents understood what it meant. And then they knew what to do. But that's a very, I would say, rare reality in the Indian context. But my friends who've suffered depression, I'm sure it's the case with people you know, neither they know what's happening to them, neither the outside world knows what's happening to them. So I think more work has to be done on an awareness standpoint, is my 2 bits.
Agreed. I mean, I think this is a sort of phenomenal work that you're doing, and I think it was far overdue. So India is sort of going through the change where there was a social support system for mental health, which was woven into religion, woven into society, which has gotten taken away from us, but it hasn't been replaced by any sort of social acceptance of where the patient stands. So unfortunately, I mean, you know, conspiracy theories apart, we all know the degree to which a sort of modern aspirational audience tries to emulate the West. So our current solution set, just like everything else, we all want our kids to, you know, go abroad for, if not undergrad, at least grad studies. So as long as you have that model, it's going to be throwing pills at things like mental health that are going to be the solution set. So within that, to have a policy that emerges that's beyond a Prozac is not really, you know, we're not at that point yet, is where I see it. And he's absolutely right. I mean, Samyak's point about the urban working class getting more and more depressed, the sorts of infertility cases that we see on our PCOD program, many a time, all it needs is to enforce some sort of behavior change where they just stop working the crazy hours that they're working. And lo and behold, you know, the human body says, hey, okay, preservation is done, let's do procreation. So that sort of thing will, I think it's going to be time, like he rightly said, to do evidence-based medicine, therefore have the ability to design some policy around it. So I feel this is going to be very much a demand-driven initial wave. It's going to be individual families that realize that, you know, it's fine to have, it's so much better to talk about it than to just throw a pill at it. It's going to be individual users. So you're going to be driven more by the market initially. Policy will have to do some catching up. I think we're still a bit way.
Let me tell you the realistic situation. The government's solving problems where people are dying. Okay, and I don't think anybody's tracking how many people are dying because of mental health issues. Yeah, but I agree with you. The thing is,
very difficult to pinpoint.
The thing is, yeah. Yeah, but so that's on the government side. On the Indian side, and here's the way I see it, at least the last 2 years, we made a lot more progress. I mean, I don't know which company you represent, but at least I've come across 4 or 5 companies which are now doing this kind of work in this space. They've created platforms, they've even created chatbots for people to have conversations, right? Because one big driver is loneliness, and India as a society is moving towards that. I think some of these things do take time. The reality of the situation is a lot of our medical ecosystem is driven by the medical fraternity, which you are aware of, right? And you all play a huge role in either progressing the awareness of a disease or in curing a disease. And this part of this, the disease is not been as well structured and institutionalized as diabetes or cardio is, because the kind of money that is there in terms of managing the condition is way, way more than it is in mental health. Yes.
Yeah.
Can you identify yourself, please? Who you are, what's your company, what you do?
Sure. My name is Pankaj Saraf. I'm the founder and CEO of a company called Smart Medics, which is into healthcare technology. So before I tell you what the company does, very quickly about why my background and why I started this company. So I grew up in a small town in Jharkhand, and my parents, my in-laws live in a small town in UP. The towns are not really that small, given the population of both these towns is anywhere from 3 lakh, 4 lakh to close to 1 million. And one of the common problems that I found growing up was that there was lack of specialist doctors in these towns. So people will immediately, whether it's a knee transplant or anything with cardiology or neurology, people will rush to a Delhi or sometimes a Bombay or a Bangalore. So when Mr. N. Chandra was this morning talking about increasing the productivity of doctors and finding a way so that these existing supply of doctors can better benefit the patients in India, that was great to hear, because that's exactly what we are doing. We have created, under Smart Medics, we've created a platform where the specialist doctors can provide consultation to patients in a small town. And so patients can share test reports, they can get digital prescription and so on and so forth. The challenge, however, what I've faced is, and that's coming to my question now, the challenge that I've faced is the economics seem to be challenging. So the customer acquisition cost that we are facing requires that a customer comes a certain number of times to the platform so that it's economically viable. So that leads me to two levels of thinking. One is you keep on raising funding in the hope that sometimes, even if it's a loss-making large venture, people will overlook the real economics, which may or may not, maybe at some scale, when it becomes so big, the customer acquisition cost will go down, and the economics may pan out. So keep on fundraising. The second level is to think, well, maybe healthcare is, there's a clear need, but there are certain economic models which will not work out for a for-profit venture. So is a social impact or non-profit the right way to go? So based on your experience, what would you advise to entrepreneurs like me, where the problem solving may not exactly align with the economic reality at the moment?
We had a client with a similar problem. Unfortunately or fortunately, the only solution is to go the big pharma way. One good thing is they know how to create demand and sustain demand. So I think that one of the solutions to your challenge lies in messaging and strategic messaging to get people to keep coming back by building in those strategic incentives or positive fear that I spoke about. Because that is something, at least in the case of healthcare, works quite powerfully. And I'd be happy to kind of take it off the line later and chat with you how. But I think that's the only way to keep getting them back, using the power of positive fear and messaging, as long as your conscience is clear that it's for their larger good and not to peddle them some pills.
I mean, telehealth actually globally as a model has gone through various versions. India started telehealth before its time. I remember 4 or 5 years ago, there were 600 to 700 telehealth pilots. All of them died. I'm personally not in favor of, unless you can build a monopoly to actually pay money to acquire customers, because that's not a sustainable model. I mean, you'll ultimately bleed yourself to death, unless you're sure that you have so much money or you have something that you will garner 50, 60% of the market, which is not the case in a model like healthcare. I mean, in a model like healthcare, unless you've doing something really disruptive, there is no country, no company which has really gone and created a virtual monopoly. So that's number one. I think number two is where telehealth has succeeded is in the US, where a large part of it actually has been driven by the payer. So the insurance companies actually forced people who were traditionally going to doctors to actually use telehealth. because their cost to deliver that care was much lesser through the healthcare platform. And then they saw that even dermatology, pediatrics, mental health, sexual health was all being dealt by telehealth platforms. And that became a major business in the US. I think India is still not, to my mind, yet ready for it. Okay? I think there are lots of people who've tried to build this model. Either they have created franchise-based systems. So you've tied up with a Medanta or a Fortis or an Apollo and almost become a conduit for patient referrals from smaller units. And that's really been your revenue model in some way. But creating a healthcare platform on your own and trying to pay and buy customers, because a big part of it is behavior change also, right? As a person, I will be way more comfortable going and speaking to a doctor personally and getting a shot or a tablet from him, especially in the areas you are trying to set up your business, compared to me just being comfortable having a video chat on the phone. So I'll be happy to chat more offline with you because I've looked at a few, but that's really my initial sense. Yeah.
Yeah, hi, my name is Sohit Kapoor. We run a healthcare venture called Briefcase, which helps users manage their medical records digitally. So the core idea about, when we talk about telemedicine or when we talk about healthcare, the way Chandra was talking about, we believe fundamentally that digital medical records would form the basis of all communication between the patient and the doctor and likewise. And unlike a US where the insurer or the payer controls the system, there's no one to control the system. So we've done a B2C kind of start where we are aggregating or we are getting the patients to aggregate their medical records on our platform. Yeah. Question is similar about, what is our biggest challenge? And our biggest challenge is behavior, our biggest challenge is inertia. How do you get the users to do something which is probably good for them? So we've tried one line of messaging to say, God forbid you are in an emergency and you need to access your medical records and they're locked up at home, what do you do? So in some sense, the positive reinforcement, the positive fear, we've tried that messaging. It's shown some success, but early days for us. So just based on the experience of the three of you, what do you believe would kind of start hitting the message harder to the users? And B, do you believe with all these regulations coming from the government around EHR and stuff like that, do you see a scenario building out where this would kind of become mandated? Yeah. For example, the way it has happened in the financial services side.
It's going to happen. So the government is building something called a national health stack, where they will create individual patient records. It's still some time away. Okay, so that's number one. Number two is, I think what you're doing is great, and there is a big opportunity in India to do this. However, there are 2 or 3 things you may want to keep note of. You are asking the patient or the individual to proactively put something out there on his own. So unless you don't create a major incentive or disincentive, there is very little reason why he or she will do it and sustain it. You may get records for a certain period of time and then it will go off, okay? Or unless you stitch the institution together. I think that's one. The second is, the big issue I have seen with Indian tech startups is just their lack of focus on UI and UX, okay? Some of the poorest UI, UX, and we may have the greatest technology, but we put it out there so poorly that the technology fails, and it's very, very difficult for a person to navigate or use. And that's where I think many of the propositions don't work. I think the third thing is, you may want to think about what channel you want to use. Because what you're doing, actually, there are several players who are trying to do this. Some of them are going via the doctor. So what they're creating is they're creating an EMR for the doctor, and they're saying, look, I will help you manage your practice better. Okay, so I'm going to create this patient health record, and that will pull in all the tests he's done, that will pull in or digitize the prescriptions he's written. It will also give him suggestions on all the pharmacies and diagnostics that are around. So it's beyond the patient health record. And by the way, you got to store your record, right? So it almost comes in as a part of that, rather than the patient literally going and driving his own health. Because remember even what Mahesh was saying, I think the biggest challenge, not only in India but globally, is for the person or the patient to put him in the center of managing his health. Okay, you got to get somebody who's pushing him out there.
Yeah, I would sort of agree with that. I do believe that India is still a market where at least primary healthcare, when you fall sick, you expect your doctor to know. So the distrust may be there to the extent of corporate medicine to some extent. And what I mean by that is large hospital chains. We all love exchanging stories over dinner about how we got gypped. They kept my uncle in the ICU after he was dead, that kind of story. But when it comes to the neighborhood doctor or a trusted family physician, that person is still the driver of the sort of health-related decisions that you make, including whether your records are going to sit somewhere, right? So I would think that is absolutely true. You do need to drive it through a trusted vehicle rather than try to see a complete B2C, because that will be a much tougher sell. People are not ready to take healthcare into their own hands yet, especially when it comes to things like medicines and records and lab tests and things like that. We're not a DIY market yet, right? So initially we had thought of even running the PCOD program as a DIY program. Just do it yourself. It's no big deal. It's just, changing your diet and your lifestyle. But no way. India people want hand-holding. India people want guidance. That's how it goes. That's one thing. Second thing I feel is if you can bring in some value add, like Amit mentioned. So even when you're collaborating with the doctors, my suggestion would be that there are doctors who now look at the same reports, but they're able to generate deeper insights from it. So if you have something like that, that really incentivizes the person to say, once in 6 months, we're going to have a doctor look at your EMR free of charge and tell you where you might really need some intervention of a preventive nature. You need to make people want to take care of themselves. Somewhere that needs to be, sort of handed over to them. I feel maybe those are two areas you can look at.
Hi, my name's Rustam Lawyer, and I started a company called Scribe Tech. We're not exactly a startup. We've been around for about 15 years. We've been working in the voice recognition space, which is very sort of specific to the medical sector. And it is basically, we've got about 40 medical specialities in our speech recognition. So it's a very specialized type of speech recognition. We've just launched into India. And my question is that, do you feel, again, sort of moving from what the gentleman up there said, that do you feel that the government is going to start mandating better and sort of more accurate and longer health records, where this sort of technology actually becomes something that is really needed? Because currently, what we've understood from the market is there are hundreds of these HIS systems, and you're right that it's not, they're not very good sort of UIs and stuff like that. And people do these absolutely minimal amounts of reporting.
Yeah.
And, that's not good for, medical outcomes, good medical outcomes. So, I wanted to find out what your views are on that.
Sure.
And,
So a couple of things, right? One is I mentioned that there's a health stack that is being prepared, and part of that health stack is also that there are 23 parameters that will go into what is called an e-prescription. So the government has come around talking about a construct of what is an e-prescription, okay, and that will be part of it. The whole e-health record is going to probably start moving into more momentum when the wellness centers start integrating into this ecosystem, okay? But there is a game plan towards that. I think the third important thing which you must be aware is all the technology that the government is trying to build is open source. They have been very, very clear in saying that we will only use open source software. Okay, so the game is a free-for-all open game, of course. Now, we also play in the technology space, so we are implementing some technology for the government as we speak. But what we've noticed is that there are a lot of gaps in the system before they even move to a health record, right? So, for example, the HIS system is not available in many of the hospitals, and wherever it is, it's not being used. Attendance management system is not there. Okay, some basic diagnostics related information or lab information systems are not there. So all these pieces are missing. However, what is happening is today there is a personal identifier which is the NHPM ID, right? So the Ayushman Bharat has created a beneficiary ID against which they will at least start putting in the hospitalization records of the individual. So it will start at the hospital level. That much we can see happening as we go down the line. When it will transmit into an overall health record is something will take time, very, very clearly.
I want to add one point to this is that outside of the government mandate, one of the reasons why a lot of these things don't actually go on ground is the lack of trust ecosystem. So one of the fundamental truths about human behavior is that the influencer or the driver of the behavior change, which in this case could be policy or any external intervention, they don't focus on trust. While it may seem very obvious that, yeah, you have to be trusting, obviously, but then you also have to apply strategic tact to win the trust. So whether it is medical records or whether it is what you're talking about, for example, I'm not sure if this is what you do, but voice is not working, automatic voice is not working, at least with your BOP at scale, is because they know that it's not real. And that itself is a big...
This does actually work really well. But
No, I'm not trying to compete with your business model. I'm saying that from a human standpoint, we found that trust is a big factor of why people don't engage, even though the policy might mandate something.
Okay, we've just been asked to close it now. All right? Thank you so much for patiently listening. All right, thank you.
Thank you, Amit. Thank you, Mahesh. Thank you, Samyak. And on behalf of TiE, I would like to thank our speakers with a small memento.
You want to? Yeah, we should.
Yes. Yeah, please. Mr. Amit?
Yes.
Yeah.
Samyak, this is from your friend.
Yeah, Samyak. No. Yeah. And Mr. Mahesh?
Oh, no, this is for Mahesh. Thank you.
Yeah, and there is... Amit, there is one for you also. You have to take it.
For the last 10 TiEcons, I've got one each.
Yeah. Yeah. Okay.
Thank you.
Thank you.
For our records.
Thank you.
And ladies and gentlemen, don't go away. We have a very, very exciting session here of Angels Over Lunch. We have some of the most well-known angel investors in the next session, which is starting soon.